Dan, it's really wonderful to see you again, and thank you so much for joining us and being interviewed for the Integrative Mental Health University. Please update us on what you're doing now and where you're located.
It's a pleasure to join you, Emma, and thank you for including me in this wonderful series.
You're welcome.
I introduced myself amongst friends as a psychiatrist with a little bit of trepidation because I find that today people expect psychiatrists just to be prescribing medications.
Oh.
When I trained, psychiatry was all psychotherapy. Mm-hmm. I've moved from the US to Canada, where I practice as a holistic therapist. Uh-huh. I teach people WE, a method of self-healing that releases physical and psychological pains of all sorts. WE is so quick and works so effectively and deeply that people find they can release anything they'd like to let go of within minutes. And even more delicious, they can replace it with positives instead of the negatives that they've been carrying.
That sounds almost miraculous, Dan.
It's actually better than any other method I've ever known.
Would you say this would work for post-traumatic stress syndrome too, and some difficult things that people are carrying along with them? Especially, I'm thinking about people coming back from military.
PTSD and complex PTSD have responded dramatically, even where there's dissociation, like multiple personality. Oh. The nice thing about WE is that people can use it on their own. It involves tapping on the right and left side of the body, which I've taken from eye movement desensitization and reprocessing, that's EMDR, and an affirmation that's individualized to the person, such as, even though I have this horrible fear of loud noises, or even though my temper gets triggered very easily by, and they name what it is. And then they add a counteracting affirmation, such as, but I still love and accept myself wholly and completely. That trio of processes, the tapping, the statement of the issue, and the counteracting affirmation, neutralize whatever you'd like to release. In a similar manner, you can then replace what you've released with a positive. So a person might say, when I am given a challenge, I can respond with care and loving rather than anger as I used to. And I love and accept myself.
Yes.
They're tapping at the same time. The positives get stronger, just like the negatives got weaker.
Good explanation. Well, I know, Dan, that you've been very involved with this for a number of years, and there's also been a considerable amount of research that's been done on techniques that are almost exactly like what you're practicing. And you sent me a list of some of those references, which I'll post at the end of this intro, so people who are interested in the research can look it up. And also at the end of this brief introduction will be your contact information should people want to take a course with you or read your books or contact you directly. So we'll say goodbye for now, and then I'll go on with a longer presentation and with you later.